So good evening, everyone. And I'm very happy to be here again with you all with another topic, that is diet and nutrition in chronic ailments. Is the screen visible to all?
Yes, doctor.
Okay, fine. Great. So today we are talking about diet and nutrition in chronic ailments. I will first take you through the chronic ailments, which are a concern for you as well as for a lot of patients, and of course for nutritionists as well. And how you all can, as practitioners, also give at least the broad guidance to your patients so that they are able to improve their lifestyle, they're able to at least bring their levels within the normal range. Now, before starting the details about how will you manage certain conditions, I thought it is very important to first make you know that how do we plan the diets, or what are the important points that is to be kept in mind while planning the diets. So any food is grouped into some or the other food group. So there are 7 broad food groups which are required by everybody, and we require some of the other forms or maybe directly in some percentages of these food groups. For example, the first one is cereals. This is a staple. You and me have been eating chapatis, rice, poha, upma, the cereals, this as our staple. It may vary from state to state. Say, for example, in the northern parts of the country, you may see more of wheat being used, and in the southern part and the eastern part, rice being used. We are also talking about millets these days. So millets are also a part of the cereals. When we say millets, it is all the traditional cereals such as ragi or nachni, which is usually found in the south. Even in Maharashtra, it is found. Then you have your bajra, jowar, jaw, which is also found in our country. So these are a part of the cereals, and they are much better compared to any other cereal which is available. These can be given in various conditions. Say, for example, if you have to control sugars, or there is gluten enteropathy or gluten insensitivity, or you want to make the patient lose weight, or you want to treat constipation. So millets are a boon for us. And why we should promote millets is because it is very easily available in our country, and India is the largest producer of millets. So when we are home growing a particular cereal, we must make the best use of it. Second food group is the pulses. So all your dals or whole pulses, or the sprouts, soya bean, besan, or the flours which are made out of pulses are covered under pulses or this categories. Some people call it dal or lentils or pulses, or maybe a plant protein group, which is very, very popular. So all the types of pulses when we will talk about, say a moong dal, tur dal, or whole moong, chana, urad, we will be referring to this particular food group. Third is the fruits and vegetables. So all the natural vegetables, whether they are leafy vegetables or starchy vegetables such as potato, beetroot, suran, sweet potato, etc., or other vegetables such as bhindi, bangan, etc., will also be covered in the vegetable category. When we say fruits, all the juicy, non-juicy fruits will fall under this particular category. The fruits are all the seasonal fruits whenever we refer to. But now what is happening is we are getting all types of fruits in all the seasons. But still, for example, berries are still limited to winter seasons. Strawberries are also limited to winters. Watermelon is the fruit of summer. Mango is again, say, between March to May. So we will be using mostly the fruits that are seasonally available, and we will promote that. Not the frozen forms or not the juice forms. Next category is the animal food category, which is meat, fish, chicken, egg, milk, and milk products. So all the animal foods will fall under this particular category. Whenever we refer to this category, we will always encourage patients using the lean meats, first thing. Second thing is, as far as possible, it should be fresh, not the frozen ones or not the ones which are packaged. Then is nuts and oilseeds. So here, I would just throw light on 3 things. One is nuts, then is dry fruits, and there is oilseeds. So nuts is anything which is hard. Say, for example, cashew nut, almond, walnut, pista, tree nuts, hazelnuts, Brazilian nuts. So all these ending with nuts, or some of them which are not even ending with nuts, but they are hard in texture, are nuts. Dry fruits are the dried forms of the natural fruits available. For example, your dates, raisins, figs, etc. will come in the category of dry fruits. Oil seeds is another group which has chia seeds, flax seeds, pumpkin, sunflower seeds, etc. So this, again, the entire group is good, provided we know how much quantity to be added and where it has to be inserted. Next category is fats and oils. So when we refer to this category, it has everything which has got high fat as the composition. For example, ghee, butter, mayo, or things which are made out of oil, or your salad dressings. And oil is anything which is liquid in consistency. For example, your refined oils or cooking oils. Coconut is again a part of fats and oils, but it is midway. So it is saturated, and that's the reason it gets solidified on room temperature. So that, but it is a part of this particular group. Last category is sugar. So sugar means your table sugar, or if you're using any other form of sugar, which is brown sugar or maple syrups, anything which is made out of sugar will fall under this particular category. So now we know that whenever we will be planning the diet, so when we will be referring to a particular group, you will be very clear with what we are referring to. Now, most common problems that you and me might be seeing very commonly, or you might come across people facing the problems, is the following list. First is hyperacidity or gastritis. We often hear patients complaining that I'm not able to digest my food. It burns. When I sleep at night, I get irritation in the throat, and that's the reason there's dry cough. Or I keep finding myself as having acidic burps or reflux. So this is one very common problem, which could be due to indigestion, which could be related to wrong eating habits or consuming foods which are causing a lot of stimulus. Next is obesity. When we refer to obesity, it is the excess amount of fat in the body. You should never judge a patient when he or she says, I am healthy or I am overweight, I am obese. Sometimes what happens is patients have their own perception of obesity. So always check their weight, always check their, if possible, body fat percentage, if not at least BMI, so that you are able to categorize the patient as obese or overweight. Next is high uric acid or hyperuricemia. So how do you manage this? Why this is happening? We will be covering in one particular slide. Constipation is a very, very common problem. And this requires a very simple treatment of eating foods which are rich in fiber. But sometimes what happens is patients are not able, despite the fact they know that these are the foods rich in fiber, they are not able to incorporate it. So we will see ways and means of how we can insert fiber. High cholesterol levels. So this we have covered high cholesterol levels and triglyceride levels in the heart diseases diet. Stones, both gallstones and renal stones. Then hypertension, decreased vitamin B12 levels, and diabetes mellitus. So this will give you a broad idea about how do you manage so many conditions by giving you an overview of the diet that we generally prescribe to our patients. Now, the first point is, how do you understand whether the patient has got normal weight or not? So there is a very simple formula called Broca's index. Now, for example, men, we'll take an example of a height of 5 feet 5 inches. So 5 feet 5 inches, 5 feet 5 inches in centimeters is 165 centimeters. When you subtract 100, the remaining value is 65. So this should be more or less here and there. See, 5 kgs and here and there, you will definitely find. But this is giving you a rough idea whether the patient is overweight or underweight or normal weight. Similarly, for women of the same height, so 165 centimeters, if a woman has a height, you have to subtract 105. So you cannot subtract 100. The reason is women have more, for the same height, women have to be a little lesser in weight compared to men. Otherwise, their BMI or body fat percentage will alter. So height minus 105. So for the same height, the woman should be around 60 kgs. See, sometimes you may come across 61, 62 here. See, 5 kgs here and there is something when you're dealing with population at large, it can be considered. But if it is higher, or if it is lesser, then you will have to counsel the patients accordingly for the diet. Now, suppose if your patient is suffering from obesity, what are you going to do? So first of all, we need to understand what kind of a body type they have. Usually what happens is, if the person is obese right from the beginning, and he might be very sedentary, he might be eating wrong foods. So first thing is that we need to make him active, at least prescribe good diet and a good exercise plan. If he or she is able to lose it, that means the patient does not have a problem in losing weight due to diet and exercise. But you will come across some people who have genetic predisposition, which means right from the beginning, they have never had a normal weight. They have always been overweight or obese. And especially when a person is overweight or obese in adolescence, and then as a young adult, he's overweight, it is very difficult for him to come back to the ideal body weight. So here we will not be targeting ideal body weight. We will be counseling him to think about fitness and to lose weight at a pace which is consistent and which is easy for him to follow. So now what you have to check. Many a times it so happens that there is excessive eating. So patient does not know how much quantity to eat. You and me cannot always control the amount of food that they are eating. So what you have to do is, you have to first speak to them about how much quantity of rice or chapatis or the cereals that they're having. If the cereal portion is higher, say for example, you have a patient in front of you who's consuming 4 chapatis, 1 katori vegetable and dal, and that's his meal. Or usually they carry the packed lunch, so they have either dal rice or khichdi or chapati vegetable. If you cut down one part of the cereal, either the chapati or the portion of rice, you will be able to at least get good results. But the patient will feel hungry. So how do you compensate that? So first of all, encourage him to have small and frequent meals. Second thing, what you do is, you tell the patient that instead of increasing your cereal, increase or introduce salad or have a glass of buttermilk. See, liquid gives you early satiety. It also gives you good nutrients and you have increased the protein part of your diet. Plus, you will be able to control the hunger which is caused due to reduction of the cereal. Sometimes what happens is we require something to drink with the meals. So I have quite few young patients who like to drink something. So they often go for fruit juices because they say that we've not added sugar. This is the fruit juice which is natural. So we are getting a good amount of fruits in our juices. But what happens is, fruit itself is rich in sugar. So even if you don't add any table sugar to it, you are increasing the concentrate of sugar through the juices without any fiber, which will go into the system and get rapidly absorbed. And you will be surprised to know, if a person consumes fruit juices regularly, say maybe 1 glass every second day. So in a month of 30 days, he or she is consuming around 15 to 16 days of fruit juice. He or she will end up gaining 1 kg weight straight. And this has been our observation when we've been doing mass assessments of patients. And that's the reason when we have cut down this fruit juice, they have been able to control that weight gain. Now, so why vegetable juices? Vegetable juices, if you have experienced, they are not sweet. They are not acidic. This is the category of food which is alkaline. When you consume alkaline foods, you are treating gastritis. You are also able to give the person something which is very filling. See, now fruit juices can also be converted into smoothies, which means that you are able to retain the pulp and they are thicker. So when you drink such a thing, it is as good as one of your meals. And that's when you will be able to help patient control the amount of calories the person is consuming. Third common thing is, we don't realize. See, sometimes our lunch meetings or sometimes we have evening snacks outside. Weekend is the custom. So every weekend we are eating outside. So if suppose we've had many meetings or we've been eating out once or twice a week, then cut down at least on the weekends, or try and cut down your excessive calories in the next meal. If your lunch meeting was there, then try and have a salad meal at night or a whole meal soup or a vegetable smoothie, so that you are cutting down on the calories and you are maintaining the budget of calories for that particular day. Next is oil and sugar. Here we make a lot of mistakes. See, we may take sugar in tea or coffee or the beverages that we are drinking. We may also end up eating one sweet, or we may end up having a dessert in the meals, or then we may have the habit of having a chocolate after every meal. So this is nothing but increasing your sugar intake. And oil, what happens is many people do not realize if they are cooking or they have a cook at home, they unknowingly put a lot of oil in the vegetables or foods. And then what happens is when the amount of oil is very high, your vegetables are calorie dense. And when the calorie dense vegetables are being consumed on a regular basis, then you are unknowingly gaining weight. So you have to always remember that there is a budget to oil and sugar. You cannot have excess amount of oil and sugar at any point in time. So many times patients ask me, I'm not a diabetic. I'm a very young patient. Can I not have a lot of sugar? So the sugar which is permitted for an individual who's not diabetic or who's not even targeting weight loss is only 2 teaspoons in a day. The reason is because if you take one particular food group in excess, you are compromising on the other food group. Similarly, the oil or the total fat, when we talk about, should be roughly around 500 to 600 ml per person per month. So which means 3 teaspoons to 4 teaspoons per day, and it ends up in 450 to 500 or at the max 600 ml in a month's time. Now, this is a very common problem. Sometimes what happens is the patient might come to you with high blood pressure reading. Though he is not hypertensive, he is not taking any tablet. One time reading, sometimes what happens is only one time reading is high. So patients feel that I'm not hypertensive, I've got white coat hypertension because I'm in the hospital. Fair enough. Give him a dietary change, give him counseling. Maybe they can sit and do some breathing exercise and we can do it again, or they can monitor the blood pressure at home. But there are few things which will help the patient to control the blood pressure. Many of us have salt sensitive hypertension, which means even if we take extra salt in one meal, for example, the lunch had buttermilk, which was containing a lot of salt, or the salad had a salad dressing, which was rich in salt. Papad pickles are a very common accompaniment with the meals, or preserved chutneys, that is the chutneys which have been made and we are using the packaged ones. So they are preserved in salt. This is the hidden salt which is present in the food. You may not be adding a lot of salt in the vegetables, but this hidden salt is increasing the salt content. And then unknowingly, we add salt in curds or atta, that is the flour which is needed at home. The salads, people do not find salads interesting if there is no salt or pepper or any other dressing not present in the salads. So with this, what is happening is unknowingly, we are increasing our salt. Now, sometimes people ask me, is there any amount of salt which you can specify for a person? So if you and me are normal people who are having no blood pressure, no high blood pressure, but we have to check that regularly, then also we are not supposed to have excess amount of salt. So try and always keep your salt intake to less than 1 teaspoon per day. This is something which you and me who are working in the offices in the closed environments can follow. The reason is because when you go outdoor and when you're sweating too much, then your salt requirement may be higher. Some people have lower blood pressure, and that's the reason why they may have to eat frequently. So they may require small amount of salt here and there as well. So that's the reason why there cannot be one standard recommendation for salt. It may vary depending upon your physical activity. It may vary in the region where you are staying. If your exposure to sun is higher, the sweating is higher, you may require uh, slightly more than 4 or 3.5 grams of salt. So that's the reason why always check patients working sedentary lifestyle or moderate lifestyle, indoor and outdoor, and the geography the person is staying. Now, if we are cutting down the salt, people have a complaint that the food is not palatable, the food is not acceptable. So what can be done in that case is the accompaniments or adjuvants such as lemon, tamarind or vinegar can be used. Vinegar is weakly acidic, so it gives a little tangy taste to the food, which many patients may enjoy. Tamarind is a very good accompaniment. The reason is because it's a natural thing. It is not preserved or it is not a chemical thing, which is a chemical in nature. So natural foods will enhance the taste without giving any side effects. When we cut down peppers and pickles, so we encourage patients to make chutneys fresh at home. Say, for example, coriander chutney, the taste can always be enhanced by adding zira and lime. Or if you are allergic to lime, you do not want to have lime, then curd is a very good substitute for making fresh chutneys. You can always prepare pickles using water. We call it water-based pickles where oil is not used. And to preserve it, you can add vinegar on top, which also does not let the pickles get spoiled. Now, the recommendation for a diet for controlling blood pressure is increase the serving of raw foods. So what can be done is, it is very difficult to have large serving of fruits for anybody, but it is possible to have salads in 2 meals, fruit at least in 1 meal, which is able to give you good quantity of natural antioxidants, which help in relaxation of the body and also controlling hypertension. If you feel you want to add something to your salads as a salad dressing, curd is a very good option. Lemon can be used, roasted zira can be added, or vinegar can also be used. Like onions in vinegar, green chili in vinegar is a very popular side adjuvant with the meats, which will not cause any problems. Now, coming on to the most important condition which we see the patients of every day, that is diabetes mellitus. Now, here what happens is patients have the first question as, if not table sugar, can I have honey? Can I have jaggery? Jaggery is supposed to be natural. Jaggery has iron. So what happens is, if you look at the glycemic index, that is, the sugar making ability of these foods is very high or almost similar. Whether it is sugar, jaggery, it is quite similar. Now, why honey is also to be restricted, though it is fructose sugar? The problem is that the moment you allow honey and you check the sugars of the patient later, we have found that it is also contributing to increase in blood sugar levels. So that's the reason why we have restricted all these food items for our patients. So what do we give? Patients then go on to artificial sweeteners, chemical sweeteners, or natural sweeteners. So what we have zeroed down on is that all the chemical sweeteners are giving side effects at one point in time or the other. Stevia, which used to be talked very high some years back, has also shown to have some side effects in patients. So we are not very much in favor of using stevia. We are encouraging patients to have date sugar, the dry date sugar, but in small quantity. The reason is dates come in various varieties and the GI of dates vary. So if you allow them in small quantities and that also in the dried forms, then the sweetness is less and you are not giving any kind of artificial sweetener to your patients. Then the next problem is the evening snack. If you do a survey of your patients or the clients who are coming to consult you, you will realize evening snack has always been a problem. They generally have vada pav, samosa, bhajiyas, etc. because they are easily available. Most of the office canteens also provide these kinds of snacks. So encourage them to carry roasted snacks from home. And believe me, we have wide range of snacks available these days. The puffed cereals, which are puffed jowar, bajra, roasted makhanas, or you also have puffed wheat, puffed oats also available. So they have 5 days a week and they have 5 different snacks which they can have it. If they are at home, I generally encourage them to have sprouts. The reason is sprout is one food which is able to cater to a lot of things. Good fiber, good protein, good nutrients, the amount of vitamins and minerals present in sprouts is very high. So I feel when you are able to have so many nutrients through one food, you should definitely explore that. And of course, roasted chana is easily available. That can also be taken. One question which is often asked is, what about peanuts? So problem is, peanuts is nothing but a category of nuts which is high in fats. So when you take 100 grams of nuts, you are almost having the entire day's fat in that particular snack. So what we encourage is, you can have some bit of peanuts added to any of your dishes, but do not have only peanuts as the evening snack. So your calorie density of that food gets reduced and you're not getting excessive calories in one particular meal. Then the popular foods are sago, that is sabudana, arrowroot flour, which is used to do the coating of your aloo tikkis or various types of tikkis which are being made, and the refined flour, such as corn flour. So these three things will get readily absorbed and will increase the sugars. So instead of these, it is better. Suppose if somebody is fasting or somebody has to do coating, Rajgira is a better option that can be used, or besan can be used for coating. The reason is besan is nothing but pulse, so it will have low glycemic index and it will not affect the texture, it will not affect the taste of your food as well. Now, when people are using single grain flour or ready-made atta, see, ready-made atta, we consider it to be a processed flour. So it is better to have a mixed grain and that also milled by you in a specific proportion. For example, if you have wheat in a particular proportion, jowar, chana if you want to add, or soybean you have to add. Remember, soybean has to be added in the least quantity because it is really nutrient dense. And then when we talk about the others, it could be in a particular ratio. So when you prepare a flour, you know the quality of the ingredients that are being added. And this will be much healthier compared to the ones which is available outside. And you see the chapati texture. When you make it yourself, you will realize that it is quite different. Nuts is an all-time food which is allowed in most of the conditions. So patients should utilize this. If not a large quantity, at least few nuts, maybe if not one handful, half a handful should be tried so that you do not feel too heavy, but you are able to have a good snack as nuts in the natural form. It also has a lot. It is a superfood. Why? Because it has so many nutrients. It has fiber. It has so many minerals and vitamins, and it helps not only to control sugars, but also give you a tasty snack. Now, many patients ask us, I'm a diabetic. Am I allowed to have fruit? Or can I have a fruit juice of the fruit which is allowed to me? See, if one fruit a day is allowed to a diabetic, and when they are well controlled, we even allow them other fruits as well. We may increase the quantity then, but it all depends on how much carbohydrate are they consuming during the day. So at least allow them one fruit as a mid-morning or a mid-evening snack. And salads should be encouraged in both the meals, both in lunch as well as dinner. It may be an interesting salad. Sometimes you may have it in the form of raita. Sometimes you may have it in the form of soups. Sometimes you can mix that excess vegetable in your dal or in your atta so that you are able to increase the amount of vegetables being consumed in the meal. Next is coconut and fried nuts. So when we say nuts, it should be as natural as possible. Cashews should not be fried, or cashew gravy should not be added to the vegetables, or too much of peanuts, and that also fried forms should be avoided. Coconut should not be added to the gravies because then it is increasing the amount of fats of that particular dish. So as far as possible, only those traditional dishes where you cannot do without it, add some quantity, but in your routine food, try and avoid it. Then they often ask us, will the rice increase the sugars or should I switch over to chapatis? I'm a South Indian, but then I've been asked to have a chapati. See, rice and cereal both will increase your sugars. So whatever cereal that you're consuming has to be in a smaller quantity. It cannot be 4, 5, or 6 chapatis in a meal. Whenever you are consuming a large meal, try and first cut down on the carbs, that is the cereal, increase the salad, increase the buttermilk or curd or dal. This way, you will be able to make the macronutrient portion or the ratios much better and in favor of diabetes. Coming on to coronary artery disease or heart problems, mostly what happens is patients, when they eat outside, they are consuming very bad fats. So say, for example, when you are eating a bhajia from outside versus when you make bhajia at home, what is the difference? It is the type of oil that the person is being using. And this oil may have been used for frying and refrying many a times. So this oil develops a lot of peroxides, which are not good for heart. Similarly, the oil that he will use will be a PUFA-rich oil. That means an oil such as sunflower or corn oil, which has long double bonds or number of double bonds or more. And when it is heated, a lot of hydrogen will sit on it and it will convert that into hydrogenated fat. So when you use vanaspatis or hydrogenated fat, this is quite bad and it increases your bad cholesterol. And if the bad cholesterol increases, the chances of heart problems are higher. So try and avoid that and use blend oils or rice bran oil, till oil, or groundnut oil for your routine cooking. And if you want to have oil blends, commercially made oil blends are available. Combination of rice bran with till, or sunflower with rice bran, or safflower with rice bran. So these are quite good and they have been made in a manner that your monounsaturated to polyunsaturated to saturated fatty acid ratio is desirable. As far as possible, avoid fried foods, fried non-veg, fried vegetarian foods. The moment you fry, this particular procedure, which we discussed, PUFA to hydrogenated fat formation occurs. And this is very unhealthy. So try and avoid this and switch over to roasted foods as far as possible. Bakery items are the worst for any heart patients or any patients who you are treating for hypercholesterolemia. The reason is the bakery uses the worst fat, and the trans fats that we talk about, which increases your bad cholesterol and decreases good cholesterol, is present mostly in bakery items and the sweets that they make. See, most of your Indian sweets, the mawas, etc., mawa barfis, they also have high trans fats. So as far as possible, cut down on these and switch over to date sweets or switch over to chickpeas, which will not have these bad fats. Then all forms of refined sugars are bad for blood pressure as well as for heart problems. The reason is they will increase triglycerides. So when the triglycerides increases, VLDL will also increase, and then your ratio will get disturbed. So what is the way out? Incorporate foods which help in lowering cholesterol, flax seeds or other oil seeds. They are good. Nuts are very good. Especially almond and walnut are very popular and they are being taken by people. So they should be encouraged, and other nuts can also be taken in the natural forms. Now, when we talk about high triglycerides, we always encourage omega-3. So roasted fish or the fish which are fatty fish, such as salmon, herring, tuna, cod, they will be very good for giving you omega-3, and you can prescribe that to your patients as well. When we ask patients to select fruits, see, there are certain people who will have very limited amount of fruits or very selective fruits. So we tell them, try and pick up the darker colored fruits because the amount of antioxidants are higher in dark colored fruits compared to the lighter shades. For example, green grapes versus red grapes or black grapes. So red and black will have higher antioxidants. So this is the way you should educate your patient and encourage them to eat variety. Salads are a savior for coronary patients. The reason is high fiber will always help in removing the excess amount of cholesterol deposits, which are very fresh and just happening. And then always ask them to have salads. This will also cut down on the refined carbohydrates that they are consuming. If the fiber intake is less due to any reasons, then you may prescribe fiber supplements. Otherwise, the first preference is always fruits and vegetables. Now, you may also come across B12 deficiency as a major concern amongst your patients. What happens is, though patients are non-vegetarians and they still have B12 deficiency. So what could be the reason? And you will be surprised to know we studied around 100 non-vegetarian patients who used to get admitted to a hospital. And we used to get their B12 levels done. Around 60 to 70% of the non-vegetarian patients also had B12 deficiency. One reason is all the non-vegetarian foods, the organ meats or the lean meats also, they are used in such a manner in recipes where there is either a lot of cooking involved or reheating is involved. Similarly, those who consume milk. See, in Indian families, what happens is they will boil the milk in the morning and then they will reheat the milk when they have to drink again. So instead of that, what you should do, only boil the amount of milk that is needed for that particular meal. For example, if there is only one person to drink milk, boil only half a liter. One glass can be used by that person. Another glass of milk should be used to set the curds. So whenever you need the milk next, you will boil only that much required amount of milk. The reheating is completely stopped here. With reheating, you will be surprised to know the B12 can reduce up to 50% only with reheating. So it is a very, very heat labile vitamin. Avoid any kind of reheating or avoid any kind of prolonged cooking with the foods which contain B12. Unfortunately, B12 is present only in the animal foods. So that's the reason to meet the requirement. See, the requirement is only 2 micrograms. But to reach to that level, your patients have to have 2 bowls of curds and 2 glasses of milk if the patient is vegetarian. If the patient is eating egg whites, 2 egg whites, 2 bowls of curd or 2 glasses of milk. This could be the combination. If the patient does not want to have milk in any form, they can make paneer at home. No ready-made paneer. Make paneer at home and at least have 20 grams of each piece and have 2 pieces of paneer along with 2 bowls of curd. So this is how the quantity has to be specified if they want to correct B12 through diet. Now, folic acid, again, when iron deficiency, folic acid deficiency happens, hemoglobin may be low on the lower side. So when we give a diet for anemia, we try and give protein, folic acid, B12 and iron all together in good quantities. So one good thing is iron and folic acid are both present in green leafy vegetables and pulses. Iron absorption can also be enhanced by adding 1 lime in the meal. Say what you do is, if your patient has been consuming green leafy vegetables and pulses regularly, change the pulse to sprouts. That is one change which will improve their iron absorption. Second thing is, either give them 2 perus or 2 guavas to eat, or 1 lemon introduced in their dals or vegetables in a day. And you see the amount of vitamin C which is increased has led to the absorption of iron, and then the hemoglobin levels will improve drastically. Now we talk about renal failure or acute kidney injury. See, this particular condition is such where still date, we are not able to give a broad guideline to the patient. We have to customize, we have to speak to the patient, we have to see what problems is the patient facing, and then only the diet is prescribed. But if at all you have an OPD patient or a walk-in patient who still has high creatinine, but it is an ARF or an AKI, it is not a chronic condition. Hemoglobin is more or less on, say, around 11. Only creat is raised. So then the first food that you should cut from the meal is animal food, which is fish, chicken, mutton, beef, and pork. Always allow them egg white. See, egg white is one food you can allow in all the conditions because it is rich in albumin. And the protein that your patient is losing in AKI or ARF or CKD is albumin. So if you give that particular protein, patients will not have hypoalbuminuria, hypoalbuminemia, and they will also not have bad swelling. So remember that albumin is a savior for them. It also improves immunity. Second thing is, these patients may also have borderline hypertension or they may have frank hypertension. So always cut down on excessive salt and the foods which have hidden salts. For example, packaged foods, or when you are using ready-to-eat foods, ready-to-cook foods, they will also have salt as a preservative. Protein supplements should be strictly checked. They should not be having any self-protein supplements. If they are having some protein gap, it should have been prescribed by the healthcare practitioner, and it should fall within the limits of the protein that you have decided for your patients. It should not exceed. Otherwise, what will happen is this protein requirement in the body is not there. So kidney will filter it out and you will see more of protein in the urine compared to the protein being absorbed. So then when the microalbuminuria is higher, then you will have to cut down further proteins and you will have to be particular about the type of protein you are giving to the patient. If the patient is a chronic kidney disease without dialysis, so here you will have to check on a lot of things. Green leafy vegetables such as palak, methi, dhania, pudina, everything has to be stopped. Beans should be stopped. So beans, when I say, it means all the vegetables which are in the pod. French beans, guar beans, papdi, green peas, they will have to be cut down. Next category of food is all your pulses. Chana, chole, rajma, besan, chana flour, soya bean, all the pulses will be cut down. So how the patients will have their rice? So moong dal and tuar dal is allowed. That is a split dal, and that also thin dals are allowed. So you can allow at least 15 grams of dal, which is raw, and then they can cook and have this dal. Nuts will have to be cut down. So if you see, all the plant proteins and the non-veg proteins are being cut. Why this is being done is, when you are giving selected amount of proteins or restricted amount of proteins to the patients, you have to give proteins of high biological value. High biological value proteins come from egg white. If you are able to make paneer at home, the liquid that is remaining after you scuttle the milk, that is a very good whey protein. And the paneer that you've made at home, that itself is rich in good proteins and low fat it is. So that is also good. Curds can be given. If there is no fluid restriction, then buttermilk can be given. Otherwise, you can concentrate buttermilk and give them in small quantities. Why animal foods are being cut is, fish, chicken, mutton also are rich in purines. So when any purine-rich food is given, your uric acid increases. So, and one of the byproducts in kidney metabolism is uric acid, besides the other nitrogenous wastes. So you cannot give any purine-rich food to the patient. Last is, what should they drink? So no fruit juices. As far as possible, soups should also be curtailed. Coconut water should also not be given. No jaljeera, nothing. So they are left with buttermilk as the only option if they want to explore anything to drink. So why this restriction is being done, though it does not contain protein? The simple reason is, renal failure also has restrictions in electrolytes, or monitoring of electrolytes is equally important. Here with cutting down on salt, we've been able to ensure that sodium will remain in normal range. Here, if we give them potassium rich foods, then serum potassium will go high, and which will also disturb the electrolyte balance. So you have to be particular about proteins. You have to also check purine containing foods, that is the animal foods, and some of the green leafy vegetables are also rich in purine. So that's the reason we have cut down that as well. Third important thing is electrolytes, that is sodium and potassium. And last important thing is the total fluids. Now we'll talk about stones. So patients may come to you with kidney stones or gallstones, and they often get confused. Yesterday only I saw a patient who had gallstones, and the patient is saying, I'm not supposed to have tomatoes. I'm not supposed to have seeds. See, seed is not the criteria of any stone restriction, or it will not lead to any stone formation. What is the principle behind giving them a particular diet? See, in kidney stones, what happens is, when you send the stone for testing, you will see most of the times it is oxalate rich, oxalate stone. Fewer times you will come across phytate stones, and other times you may come across styrolate stones, which is not related to diet. So these are the two foods which are related to diet. Oxalate rich foods and phytate rich foods have to be restricted. The moment you come to know it is this particular stone that is being formed in the body. Suppose your patient has not got the stone tested. So what do you do? To be on the safer side, you can restrict both these foods. Now, what is an oxalate-rich food? So oxalate is present in palak and til, dark chocolates, and overboiled tea and coffee. So try and cut down these foods straight away. So it is easy to cut down palak and til. There's no problem. Dark chocolates, or even, say, sometimes berries are also being restricted, but berries is a seasonal food and the consumption is not very high. So it may not give you a very good effect. But when they have tea, and especially when they're having tea from outside, which is being boiled and overboiled, it may have a lot of anti-nutritional factors. So that is one thing which we tell them to avoid completely. When we say phytate-rich food, phytate is present in the complex carbs or the cereals which have a husk. So if they want to have millets, there's no problem. But what you tell them is, sieve your flour, sieve your nachni, sieve your jowar ka flour, sieve your any other atta that is being used to make chapatis. So the phytates will be out, and then the patient will not have a problem. Third important thing is, many patients take protein supplements without any prescription, and they go into dehydration because protein requires a lot of fluids to be maintained. But they do not take that much amount of fluids, and then they end up having kidney stones. So you have to encourage your patients to avoid all these three things strictly, increase the fluid intake in whatever forms they can, and at least see how much water they are losing. Say if they're exercising, for half an hour of exercise, they need to replenish it with half a liter of water. So if they're exercising for an hour, they have to take 1 liter of fluid extra, besides the 6 to 8 glasses of water they are consuming every day. Now, why gallstones happen? Most of the times you will see it is sedentary lifestyle, obesity, and there are long gaps between the meals. There's huge consumption of refined foods, which is there. So if you want your patients to avoid having this problem, we always encourage them to take small and frequent meals, and we tell them to exercise and try and maintain the weight. The more visceral fat they're able to keep it within the range, they will have lesser problems. So encourage them to avoid refined foods and fried foods because they are only contributing to wrong diagnostics. And artificial sweeteners should also be avoided. See, sometimes what happens is they take foods which is rich in artificial sweeteners and it says low sugars or without sugar, low carbohydrate, and this leads to a lot of craving, which makes them which ends up giving them high intake of foods and thereby more calories, so they tend to put on weight. But if the patient has been treated, say cholecystectomy is done or the gallstones have been removed, then we encourage them to have simple food, non-fried foods or roasted foods with lots of fruits and vegetables, which will help them to have a better life. Now, besides the chronic ailments, I thought I will just throw some light on certain physiological conditions, at least two of them, which are very important, which you may be seeing in your practice. One is pregnancy. In pregnancy, what we do is we do a trimester-wise planning. In the first trimester, that is first, second, and third month, we encourage patients to eat food which is home cooked, which is simple, and which is as per their liking. The reason is because of high beta HCG, they have a lot of nausea, acidity, and they have food preferences. So if they eat the food of their choice in the first trimester, they are able to understand their taste buds and they feel better. For example, 60 to 70% of the patients feel better with Nimbu Pani because Nimbu Pani being alkaline, it not only gives them relief in acidity, but also curbs that nausea which is there. Second thing is coconut water. Third thing is simple snack items like kurmuras of different kinds. Makhanas help them. They may really not relish egg or breads. This egg especially increases nausea. Bread leads to constipation, so they are not very comfortable. So give them, if not chapatis, encourage them to have soups, khichdi, which is made with multiple vegetables, thin dals and rice can be taken. So simple food which is home cooked, it is not too complicated, it is not too much rich in oil and fat. That helps in controlling nausea. Now, suppose if the patient comes to you with gestational diabetes. So the first thing which you have to discourage your patient is to take any kind of sweeteners. No artificial sweeteners to be given. Strictly monitor the sugar. And if the sugar is within the range, PP less than 120 and fasting less than 90, then only you should allow them date sugar. Otherwise, you can even ask them to avoid any forms of sugars. One fruit a day is allowed, that is fine, but encourage them to take more of complex carbs, millet-based diet, and more of pulses, dals, and sprouts, which help them to control the sugars faster. If there is a patient of pregnancy-induced hypertension, please do not put the patient on zero salt. Many a times it so happens the patient's salt is cut to zero. And when the patient comes to us, they tell us, I'm not allowed to even touch the salt or see the salt. See here, what mistake are we making is that if there is no salt given to the patient, there is no iodine going in the diet, which may have more repercussions compared to the blood pressure. And PIH is not always salt induced. So we have to give them little amount of salt. Iodine requirement in the body is less. Even if you give, say, half a teaspoon of salt or even lesser than that, it is able to give you the iodine which is required. So there we have no worries. So reduce the salt, but allow some amount of salt to the patient. Now the question comes with salt. Remember, no pink salt, no senda namak, black salt or rock salt. It has to be iodized salt of any brand, which is a normal salt. If you want to give low sodium salt, that you may give it to a hypertension patient, but to a pregnant woman, you can give a normal salt in reduced quantity. With this, what will happen is her electrolytes will not go haywire, iodine will continuously be available. And if you think that by giving rock salt or the other salts, blood pressure will come under control, believe me, it does not. The amount of sodium which is present in all these types of salt is the same. So we have to give them a normal salt with normal sodium and potassium. If you're giving a high potassium salt, then the sodium is less, potassium is higher. This we do not give in pregnancy, but in hypertensive cases, it is fine, and not even in renal cases. So no low sodium salt in renal cases. Here, what is important in PIH is if you increase the quantity of fruits for that particular patient, it works better. Rest is very important, and high protein diets in both these conditions, GDM and PIH, is required because an early delivery is usually indicated in such cases. Now, last is IUGR or low weight gain. So low weight gain as in the mother has not been able to gain weight, and that's the reason the fetal weight is low. In intrauterine growth retardation, what happens is the baby's weight is not as per the gestational age of the mother. So here what we encourage is not only a high protein diet, but also we look into specific amino acids, especially the essential amino acids. So a lot of supplements are available of essential amino acids, which gynacs may prescribe or the dietitians may prescribe. Otherwise, if patient comes to you and you're not aware of these products, then you may put the patient on a high protein diet. Always give a maternal protein supplement to the patients. Do not give a plain high protein supplement to the mothers. The reason being, in maternal supplements, there is DHA, there is choline, there is good amount of iron, calcium besides protein. But in a standard high protein supplement, you will not find all these nutrients because the requirement of these nutrients for a normal person is as per the RDA. Here in pregnancy, this is required because the baby's brain is also growing at a specific pace. So if you give these nutrients, baby's growth is really good. Now coming on to lactation. In lactation, high calcium, high iron, and high protein food is indicated. So if they are taking supplements, let them continue. If they are not taking supplements, make sure they take this in good quantities through the diet. Omega-3 rich food is very much important. The reason is if omega-3 is not given to the mothers, especially during lactation, they have postpartum depression. And we've seen omega-3 rich foods help them come out of this. How do you give that? Give flax seeds, give soya. If the patient is non-vegetarian, give a seafood. Look at the season also. During rainy season, we generally discourage fish. But if the time of delivery is such that the lady has delivered during rainy season, then you may think of giving omega-3 supplements. Nutrient-dense food should be given. It should not be calorie-dense. It should be nutrient-dense because she is a lactating mother. If the food is rich in nutrients, the milk quality will be better. So when I say nutrient-dense food, I'll give you an example. You may fill up the stomach by giving a plain chapati and dal to the patient, or you may make a multi-grain chapati with palak or methi added to the atta, and then you are giving a dal which is thicker and with some other vegetables being added. So the quantity of the food is the same, but the nutrient density is different. As far as possible, please allow your patients to have only natural foods and discourage them to go for frozen foods or other cuisines which are being ordered from outside, especially Chinese foods, because they have a lot of additives. So this was all about the chronic ailments. Now, only a few points I will just quickly make you go through. How do you plan this kind of a diet? So I have shown you a food pyramid. Always the diet is in accordance with the exercises that the patient do. Now, this is the most popular method which is being followed nowadays. This is the Harvard plate method. Here we encourage patients to take more fruits and vegetables, then grains and starches and proteins in equal quantity, fats in smaller quantity. Dairy has to be included. If anything is missing, then only the supplement is added, otherwise not. Now, when we talk about the recommended ratios, you will always see cereals are more in quantity, followed by pulses, then fruits and vegetables, then milk and milk products. Milk and milk products and fruits and vegetables are almost in the equal quantity. So what happens is you have two proteins options, pulses as well as animal foods. So pulses, if it is 10 to 15%, you're compensating the remaining proteins with good quality options such as animal foods. Sorry. Then you have fats and sugars, which is the least, followed by a recommendation of water. Why we've added that? Many a times people forget to take normal amount of water. So what have we learned today? In all the conditions that you see, refined foods and junk foods are a big no. It has to be replaced with whole foods. Outside or processed foods are equally bad. So home cooked food is encouraged. Natural food is the best option. Always do not go for any kind of packaged foods. Roasted foods are an option against the fried foods. The reason is it is conserving the nutrients. And try and include foods from each food group so that you have a balanced meal. Thank you so much, everyone. If you wish to buy any of my books, I have given the links over here. This information, what I've shared, is present in Eat Right to Stay Bright, and diabetes book has only information related to diabetes. And this is the Gujarati version of the same English book. Thank you so much, everyone. I'm sorry, I think I took a little extra time, but now we can open the forum for questions. Okay, so now I'll just read the questions. One should drink alkaline water. See, alkaline water through those ionic filters is still under research. So we are not giving a free recommendation of inserting those. But if you wish to make alkaline water at home, I'll give you a very simple recipe. You can keep a jug of water on the table, cut some cucumber and put in it, put dash of lime in that, pudina leaves, and leave it overnight. And then you can drink that water throughout the day. Can we have rice and chapati together? Yes, you can have rice and chapati together, but both should be in controlled quantities. It should not happen that you're having too much of rice or too many chapatis. And when you eat both, then the quantity should not be very high. Can fruits be included with the meal? See, we generally discourage fruits and meal together. The simple reason is fruits are having an acidic pH, and when you have it with the meal, you may feel acidic. So if you take fruits, say as a mid-morning snack or mid-evening snack, the best part is it being low calorie. You are able to have a low calorie snack, and you are able to have it not only have a good stomach full snack, curtailing down on the calories, but also not mixing it with the meals, and then it becomes only overeating of the meals. So it's always good to have fruits as an independent snack. What salt for stones? See, salt does not cause any stones, but if you want to remain away from high blood pressure, always cut down on the excess amount of salts. It is recommended for everyone. It is not only for hypertensive patients, but for everyone. Next is, do you believe in blood group diet? See, I'll tell you, blood group is a fad diet. This was a very popular program which was written by one of the foreign authors, and then it became it came in limelight and many people started following it. But scientifically, it is not proven, and it becomes very, very difficult for an individual. Suppose if you have 4 members in the family and you have 2 blood groups, it will be very difficult for you to practically have the 2 different kinds of foods being cooked in the same meal. So it does not give any edge. It has not been proven scientifically also. That's the reason we are not encouraging patients to follow this particular diet. Multigrain atta ingredients and ratio, ma'am. Okay. See, I'll give you a very simple multigrain recipe. What you can do is you can take 4 kgs of wheat, 2 kgs of jowar, 2 kgs of oats. If you wish to add more, then 100 grams of dana methi and 100 grams of soya bean to it. And then just get it milled. But it should be milled from your side. Aapko pismana hai. Do not buy this from outside. Can you please send the link for the books? Sure. Thanks, ma'am. Okay. Then sugar is more in green grapes or black ones. Okay. So see, grapes is considered to be a food if taken more in quantity may increase the sugars. So both grapes, green and black, they come in the same family. So here we are not more worried about sugars because if the patient is diabetic, we cut the amount of grapes to bare minimum. There's only 4-5 grapes that we allow if the sugars are high. But if you take black grapes, then the advantage is you are getting more antioxidants compared to green grapes. So if you like, you should always try variety. Sometimes take green grapes, sometimes take black grapes, sometimes red grapes, whenever it is in the season. If muscle exercise is done, weight does put on. Yeah. See, so here what is important is when you are exercising, you should always check your body, do your body fat analysis. This will give you a clear picture of what is your fat percentage, what is your muscle mass, what is the ratio between the two, what is your body type. Nowadays, what happens is when you get this thing done, there is something called body type, which is mentioned in the end. Even if the patient's weight is high, since the muscle mass is more, it will never write the person to be obese. It will say solid build or good build, something like that. The comment comes in. Another important thing is it will also let you know about the visceral fat. So if the visceral fat is low, then you don't have to worry at all because that is the main cause of diseases. So although you may be showing higher on weight, but if your body composition analysis is very good, it is not showing high fat percentage, then you are absolutely well. Then there is any differences in diets for increase in creatinine and increase of okay. See, sometimes what happens, every hyperuricemia patient may not have high creatinine, and every high creatinine patient may not have high uric acid. Now, if there is only high uric acid and creatinine is normal, then the diet is slightly different because here you will be allowed to have nuts. Only thing that will be cut is your fish, chicken, mutton, pork. Pulses may be asked to be taken in restricted quantities, and palak as well as beans, because they are rich in purine. Nuts not being rich in purine is allowed in uric acid. But if there is high creatinine, then we will not only cut down the animal foods, but we will also cut down nuts, complete pulses, complete leafy vegetables, and beans. In uric acid, only 1 or 2 leafy vegetables are restricted. So there is a different diet and there is a different condition when creatinine and uric acids are. Now, then we have, it is advisable to have 3 egg whites in breakfast with leafy vegetables. See, you do not decide on a particular food group just based on your liking or just based on the availability. So if you are taking 3 egg whites, what about the proteins in the other meals? Are you taking milk? Are you taking egg, curds, or are you taking fish and chicken? So whenever we decide a diet for the patients, we check the total protein the patient requires and how much is being delivered by a particular food group. So suppose if you are consuming 3 egg whites, make sure you do not have too much of chicken and fish during the day. That day you may avoid these 2 things and do not have excess amount of proteins. Low sodium and high sodium salts or happen? No. See, I'll tell you one thing. Even if you are hypertensive, always try and cut down on the quantity of salt. But if at all you just want to go for low sodium and high potassium salts, then any salt which ends in LITE. So this particular salt is always low in sodium and high in potassium. This you can take, but if you are taking excess amount of it, then your potassium may go up, which may show some changes in ECG, which is not recommended. So what I would suggest you is, even though you're taking low sodium and high potassium salts, it should not be taken in too much quantity. So I hope you, whenever you go to buy, look for LITE written on the packet, light, and those salts are lesser in or lower in salt. Can add milk or yogurt and fruit like bananas. Okay. See, now generally what happens is milk is almost neutral pH and fruit is an acidic pH. So when you mix these two, they may not give you a desirable combination, but banana, apple, mango milkshakes are very popular. They have been very popular dishes. When you consume them, if it is not giving you any kind of indigestion or discomfort, then you may continue having it, but sometimes it does not agree with the body and people usually avoid it. If you want to be on the safer side, then my suggestion to you would be Make your smoothie with vegetables. Do not add any milk product to it. It can be only vegetables, oil seeds, and then you can have it. When you have to consume a fruit, eat it as an independent snack. Milk can be taken with the breakfast and yogurts can be taken with the lunch. So you will not be consuming anything which is undesirable in terms of combinations. Can you suggest oats in any of the diet? Oh, yeah. It's very easy to use oats in your diets. And oats is one food which helps in lowering cholesterol, which helps in treating constipation, which is also good for weight management. So it's a superfood. What you should do is either you add it to your atta, the proportion that I just mentioned, or if not, then you powder the oats and keep it in your house whenever you are making idlis. So the batter of the idlis can always be improved upon by adding 1 tablespoon of oats flour. If you're making soups, add 1 tablespoon of oats flour to thicken it. If you're making your smoothies, you may again add 1 tablespoon of oats to your smoothies. So this way you will be able to add smoothies to oats to a lot of recipes. If you're making tikkis at home, again for coating, use oats flour. So you have more options to incorporate it. Any diet advice for patients having congenital single kidney? See, congenital single kidney, until and unless it is functioning, it has no restrictions. I have a patient who has congenital problem with kidneys, and the kidneys, the reports are not good. The creatinine is very high. So there we are giving that patient a particular diet. But if you have a single kidney, but it is working, all your reports are normal, then you don't have to be on any restricted diet. But if you want to prevent any kind of kidney problems, just like other people, how we advise to the others, always try and keep your blood pressure under control. Be away from ready to eat and ready to cook foods. Do not have foods with a lot of additives and preservatives. So this holds true for people who have single kidney or double kidney, who wants to avoid the kidney problems in future. Milk should be taken or not? How can we fulfill calcium requirements in children and also in old ladies? See, milk is definitely recommended because it is not only a good source of calcium, but it is also a good source of protein, B12, and the ratio of calcium to phosphorus in milk is one of the best. So if the person does not have any kind of intolerance, the person should be allowed to have milk, whether he or she is a child or an old person. Now, if the person has intolerance to milk, then what you should do is convert that milk into homemade paneer, curd or plain yogurt or buttermilk. This way you will be able to have milk products in good quantity and your calcium requirements would be met. Other sources of calcium for children and women are nuts, leafy vegetables, beans, besides milk products and pulses. They can easily be taken and they can be taken in good quantity so that these problems are the nutrient requirement is met. Can we have 1 sweet potato and 2 sweet corn every day? So, now in what context are you asking? So suppose if you have no health issues, you are allowed to eat foods from all the food groups. We don't have to restrict. If you have any specific problem, then based on that problem, we can decide whether we have to restrict it or not. Say, for example, mostly in diabetes, we avoid corn in good quantities because corn is a source of sugar and sweet potato is high in carbs. So we have to cut down your carbs in other meals. So just check what condition you have and then you can accordingly take it. What can be suggestions over water intake? Like some suggest drink warm water, empty stomach with honey and lemon. So, fat is so stubborn. If you do not exercise for more than half an hour, there is no weight loss happening. There's no fat loss happening. So imagine how hot water with lime and honey will be able to bring any kind of weight loss. So when a person is consuming lukewarm water with honey and lemon, we always tell them this is only to feel good and to start your day with some kind of an energetic beverage. Besides that, it will not do anything else. So if you're looking at weight loss, don't try this for weight loss because it will not happen. But if you want to have just a drink, you can continue. For weight loss, you will have to cut down on excessive amount of carbs, high fatty foods such as fried foods, packaged foods, or foods which are calorie dense. So always look for these foods if you're consuming in your diet. Another important thing is if you are only doing diet and no exercise, then also the weight loss will not happen. Okay, then is elephant yam a good option? See, again, no food is good or bad. So all the foods can be consumed, provided you are taking it in specific quantities. Can we have eggs like two whole? No. See, when we talk about animal foods, you have to be very clear about the cholesterol because they are rich in cholesterol. So you cannot have them every day. Can we take curds at night? Yes, at room temperature. Avocado has good fat. Yes, you can have avocado. If you're consuming avocado every day, please cut down on the amount of oil that you're consuming. So maybe 1 teaspoon of oil can be reduced. Difference between toned and premium milk. See, milk always has to be checked on the basis of the fat percentage. Toned milk has around 3% fat, and premium milk, if it is whole cream or whole milk, then it will have 6% fat. So read the label on the milk in terms of fat percentage. Alcoholic fatty liver disease is increased due to consumption of alcohol, the first thing. Second thing is, I would here require your reports of SGOT, SGPT, uric acid, as well as total cholesterol. If those are high, then you have another condition where we will have to treat that as well. So as of now, cut down on total fats, oily foods, fried foods, and alcohol if you're consuming, and go for regular exercise. How to check fat percentage? See, there are machines available for checking fat percentage. You can go to a nearby center which has a body fat analyzer. See, for weight gain, again, the same thing is we need to check your body type. If it is genetic, then you will have to aim for good fitness rather than only weight gain. And we will also have to check your total diet intake, total food intake. Again, based on the food groups, what food group are you missing? Diet for renal calculi. So here we had discussed that avoid palak, til, and millets. You should not have millets directly. You should sieve the flour and consume. Yeah. For PCOD, you will have to cut down on refined sugars, include more of home-cooked foods, no fried and oily foods, and nothing from outside. Newly diagnosed hypertension and diabetes. So cut down on salt, cut down on any fried foods, increase the consumption of nuts. This will help you to control sugars as well, and incorporate a lot of oats in your diet, which will control both these problems, and good amount of fiber through fruits and vegetables. Desi ghee, if it is made at home, can be incorporated. If it is from outside, it is not good because it will have hydrogenated fat. So try and use 1 teaspoon of ghee and 2 teaspoons of oil, so your budget remains the same. Diet rich in biotin, yes, you can have nuts, you can have sprouts, you can have leafy vegetables, which will help. But if you are aiming for hair fall, you may have to take specific biotin supplements under the guidance of a dermatologist. For fat loss, how much time one should see? Weight loss will happen at a steady speed. It is never more than half a kg per week. So you may at the max aim for 4 kgs in a month, or 10% of your initial body weight if you're doing good amount of exercise. Double tone milk will have only 1.5% fat. If your fat percentage is high, you can go for double tone milk also. For hypothyroidism, first important thing is that you need to check your vitamin D levels also. Second thing is you should aim for stress management and good amount of exercise, so that these two factors are able to keep your weight in check. Third important thing is check your medications also and TSH levels. And in the diet, there is no restriction per se as far as fruits and vegetables are concerned, but do not have oily, fried, and calorie-dense food. Yeah. How to make paneer at home? Boil the milk, bring it to room temperature, squeeze lime into it, cuddle it, and then whatever pulp remains on top, it has to be squeezed and put it under some weight, and then the paneer will be set in 24 hours. Hyperthyroid, always check if the hyperthyroid activity is more. Try to cut down salt rich in iodine. We may have to put you on salt which is without iodine. Then we have, okay, thank you so much. How many and what type of nuts should we take? See, whatever nuts are available, you can always mix all these nuts, and 1 handful is the quantity if you're taking it as an evening snack. It is advisable to take magnesium glycinate for sleep. See, you have to first find out why there is a sleep problem. Is it stress? Is it due to no physical activity? Is it there's no fatigue in the body? So we don't prescribe supplements just like that. We want patients to first have a good lifestyle. what kind of milk should be used, like fat or skim? No, see, it depends on what you're aiming at. If you are aiming at weight loss, then definitely low fat milk is recommended. If not, then you should always go for toned milk. If there is no health issues, you can use the same milk for making paneer as well. Multigrain atta at home, proportions, please repeat. 4 kgs of wheat, 2 kgs of jowar, 2 kgs of oats, 100 grams of dana methi, and 100 grams of soya bean. So, fine. Thank you so much, everyone. I think I've answered all the questions. All the best to all of you. Please follow the diet so that you all remain healthy. And this will be a pleasure for me that you've been able to follow it. Thank you, everyone.